Good afternoon. Today is April 16th, and I'll be talking about the coronavirus today too. So the first piece of news that I'd like to talk about is that another 5.2 million people filed for unemployment benefits, making it a total of 22 million people who have filed for unemployment in the last 4 weeks only. This is shocking, as another staggering increase for the fourth time has been sent again, and the latest figure from the Labor Department reflects how last week's initial unemployment claims underscores how the downdraft has spread to every corner of the economy. Hotels and restaurants, mass retailers, manufacturers, and white-collar strongholds like law firms. Basically, the economy is falling deeper and deeper into a recession that is probably the most broad-based recession we've ever seen. Some of these new jobless claims represent freshly laid off workers. Others are from people who have been trying for a week or more to file for unemployment. And the unmounted unemployment numbers probably have to add some pressure to lift restrictions on business activity. Mr. Trump today said that some measures should be relaxed soon because of the impact on workers. Because there has to be a balance of maintaining the public health and also trying not to make the economy fall further down as it is already. However, but if business conditions return to normal too quickly, a second wave of infections could spread. And the longer the wait to reopen, the painful it will be in terms of layoffs and people trying to find a job and getting the economy going and down. So if quarterly unemployment hits 30%, as the president of one Federal Reserve Bank predicts, then 15.4% of Americans will fall into poverty for the year, as found by Columbia researchers, and even in the unlikely event that the economy instantly recovers. This level of poverty would exceed the peak of the Great Recession, add nearly 10 million people to the ranks of the poor. So here we can see that the coronavirus is at the large impact that the coronavirus is having on the world economy and the U.S. economy. The second thing that I'd like to talk about today is that early research has found that people with obesity is a big risk factor, but not asthma. New studies point to obesity as the most significant risk factor after only older age for patients being hospitalized with COVID-19. 42% of American adults, are nearly 80 million people, who live with obesity, and young adults with obesity appear to be at particular risk. So this research, however, preliminary, has already been confirmed by many doctors who say that they've been struck by how seriously ill younger patients of theirs with obesity are otherwise healthy. Asthma, however, which is a respiratory failure, was particularly worrisome for many, but data released this month by New York State shows that only about 4% of COVID-19 deaths in New York were people who are known to also have asthma, which is a relatively modest amount. So this is really surprising that asthma is not a large problem when it's respiratory disease, but more common risk factors are morbid obesity, diabetes, and chronic heart disease. The third thing that I'd like to talk about today is that another testing option by Rutgers University is the first saliva test to be cleared by the FDA. The FDA authorized the test under its emergency powers to quickly clear new tests, and this approach to screening for COVID-19. The current approach to screening for COVID-19 requires healthcare workers to take a swab from the patient's nose and throat, but here all the patient has to do is just spit into a plastic tube several times. This can lessen infection risks, as many staff members have to having to actually be in the face of somebody that is symptomatic and could get the disease. And infectious disease expert said that it would help overcome some of the patient discomfort and difficulties in taking swab samples, and many people, including my family members, are really scared for testing because sometimes you have to stick something up your nasal cavity or into your throat. The accuracy of this method, by taking both saliva and swab samples, Rutgers tested the accuracy of this method and had a 100% match with the results from the swabs. So this is quite another option to just for testing and such. This saliva collection kit from Spectrum Solutions, which is a Utah company that provides similar devices for DNA-based ancestry testing services, the Rutgers lab can currently process 10,000 patient samples per day, according to books, because the patient samples of the saliva has to be taken to a lab to be processed and sent back the results. That's it. Thank you for listening and have a good day. Thank you.